Hello friends, welcome to Friend of Health. So today in this video we are trying to cover some of the important questions which can be asked in today's AIAPGT exam, and it's from the Allen's Keynote rearranged and classified edition. And most of you might have done your revisions, and there's a tendency that the first few of the remedies will be covered and you'll not be able to cover the last most drugs. So I'm just trying to see the from the middle, like from the 96th drug out of the total 187. From the 96th we'll see some important questions. You can follow this red pen which I'm showing. So only those questions, we may see all questions as important, and many times I might have marked most of the points, but don't see all those things. Only follow this pen. So one question from Cali Bichromicum. So pains in small spots can be covered with point of finger. So that is there in Calibic and Ignatia. So sometimes Calibic may not be there in the option. Ignatia will be there. So you will have to answer Ignatia. And the next question is a very repeatedly asked question. Shift rapidly from one part to another. So this pains shift. So this symbol you can see. So that's why this you have to read like this. Pains shift rapidly from one part to another. Drugs are Cali Bichromicum, Cali Sulf, Lac Caninum, and Pulsatilla. So what sometimes they can ask is one among these they will change and give in the option out of the four drugs. So except will be there. So wherever 3 or 4 are there, you have to answer that. So shift rapidly, Cali Sulf, Cali Bic, Lac Caninum, and Pulsatilla. So appear and disappear suddenly. That also Cali Bichromicum is there, and Belladonna, Ignatia, Macphos. So you know Belladonna and Macphos for this symptom. So Ignatia already the small spots Ignatia and Calibic. So just add appearance disappear suddenly, Calibic and Ignatia to this list. Belladonna, Macphos, Ignatia, and Calibic. And another question from UPSC 2002 from Calibic is headache. So this question, pain in small spots, already came in UPSC 2002 medical officer exam. Same way, headache, blurred vision, or blindness precedes the attack. Gelsemium, Lac defloratum, and Calibichromicum. So that is a very important question. And must lie down. The modalities of headache is must lie down, aversion to light and noise, sight returns as headache increases. So sight returns as headache increases. That itself can be a question other than all these points. So you can see these are separate symptoms. Must lie down, headache, must lie down, headache, aversion to light and noise, headache, sight returns as headache increases. So many remedies, iris, then natrimur and Lac defloratum and Calibichromicum. So this is a very like probable question. And you can see other bold letter questions, symptoms like nose, perceive pain in the root of nose, discharge of plug, clinkers. So whatever interesting words like normally which we don't use words are there, you have to follow that. Clinkers in Calibichromicum, tough ropey mucus, plastic exudate, all those things. And the next page, if you see the two important repeatedly asked points from Calibichromicum are sexual desire absent in fleshy people and prolapsus uteri seemingly in hot weather. A very favorite question of like MD entrance exams of previous years, Kerala MD or Delhi MD, all those MD exams it used to come, and in AIAPGT also it might come. Prolapsus uteri seemingly in hot weather, Calibichromicum, and sexual desire absent in fleshy people. And amelioration of skin symptoms, if you see, skin symptoms are better in cold weather. That is a reverse symptom of alumina and petroleum. So in the relationship session, one interesting relationship in some of the drugs is reverse of. So all the reverse of you can study. So in one of the very important reverse symptom is a skin symptom of Calibichromicum, which is a reverse of alumina and petroleum. So skin symptoms are better in cold weather. Okay. And Calibrom. So we'll skip many questions which may look very interesting and very important, because this is just a revision and prediction of some questions of Calibrom. If you see, one particular sensation in the depressed and low spirited and anxious people feel as if they would lose their mind. So feels as if they would lose their minds. That is there in Calibrom. And yeah, you can see first stage of hydrocephaloid. So you may get options like Helleborus, all those commonly brain related remedies and affections. So first stage of hydrocephaloid, go for Calibrom. Okay. And Yeah, another one very important relationship is often curative for Eugenia jumbos in acne. So this is very interesting because this kind of rare symptoms in the like rare remedies which are not listed in the Allen's keynote, but in the relationship it comes. So those are very important. Calibrom relationship. Calibrom is often curative after Eugenia jumbos in acne. So the question will be like this: which is the remedy often curative after Eugenia jumbos in acne? So calibrom. So it is common actually. Calibrom is a common remedy for acne which everyone prescribes. So you may be able to answer and don't miss it due to any confusion. Okay, and yeah, Calicarb. Calicarb is a very important polycrest, but still weak eyes after coition, pollution, abortion, measles. Till now, any question paper have not asked. I think that's why there is no mention regarding question papers like AAPGT or UPSC. But we can expect this kind of interesting one lines, bag-like swelling between upper eyelids and eyebrows. So APs, all those remedies may be like there in the option. So Calicarb, bag-like swelling between the upper eyelid and eyebrows, and Calicarb. And weak eyes after coition is pollution, abortion, measles, weak eyes, eye affection, two symptoms. Calicarb, you can remember like that, two symptoms of Calicarb eye. And the other things, yeah, suspended by a thread. So heart symptom of Calicarb is tendency to fatty degeneration, which is there also in phosphorus, and as if suspended by a thread, lachesis and Calicarb. Suspended heart suspended by a thread. So they can ask like Calicarb one option, lachesis one option, then another one prominent like heart symptom remedy like spongia or something, then they will go for A and B like that. Okay. And one relationship part of Calicarb is Hahnemann's one quote is mentioned by H.C. Allen, and that is will bring on menses when natrum mur, though apparently indicated, fails. So the option most confusing can be sepia, because we will think, okay, Ignatia, natrum mur, sepia, and we will go for sepia if we have not read this last line of Calicarb. So Calicarb, one relationship is Calicarb will bring on the menses when natrum mur, though apparently indicated, fails. It is told by Hahnemann himself. And we can see Calmia latifolia. The common name is very, very important. Family is Ericaceae, and mountain laurel. Mountain laurel. So don't get confused with like arnica, like remedies common name. So Calmia is mountain laurel. And you can see yeah, this is one important symptom: pain, sticking, darting, pressing, shooting in a downward direction. So cactus also covers that downward direction, and upward is ledum pal. And vertigo when stooping or looking down, spigelia. So all the vertigo remedies from the books like crack the entrance or Euron knots, you can like tabacum, all those remedies, Theridion, you can compare here. And yeah, eyes symptoms: severe stitching pain in the right eye and orbit, begins at sunrise, aggravation at noon, and leaves at sunset. Calmia latifolia. Begins eye pain, severe pain starts begins at the sunrise and aggravation at noon and leaves at sunset. And that also is there in natrum mur. And another remedy is from K alphabet is creosotum, and creosotum also have a lot of like symptoms which are very important, but not much asked in competitive exams. So we can expect which is not asked every time there is a possibility. So the constitution itself: dark complexion, slight, lean, ill-developed, poorly nourished, overgrown, and very tall for her age. Phosphorus and creosote. So very tall for her age, creosote. And it's a hemorrhagic diathesis. Don't bluff in like don't blindly guess any questions in from the Allen's keynote, because exact line they will be asking. So if you don't know, you cannot guess on wild, like our prescriptions. It is a hemorrhagic remedy, I will give for this, like that. If a symptom is there for hemorrhage and we know that phosphorus or creosote is hemorrhagic diathesis, we cannot just write, because that exact symptom may be then ipecac or some other remedies. So like that you have to be careful. And creosote teeth is very important. Painful dentition: teeth begin to decay as soon as they appear. Teeth begin to decay as soon as they appear. Then yeah, vomiting of pregnancy, sweetish water with talism of cholera, vomiting of cholera. Then during painful dentition, incessant and cadaverous stool. So the peculiar smells, peculiar sensation, these are very important. So creosotum, vomiting, incessant vomiting with cadaverous stool in malignant affections of stomach. Then incontinence of urine, can only urinate when lying down. So the modalities of urination, modalities of asthma, all these are very important, like medorinum asthma, all these you have to see. And smarting and burning pain during micturition, post-climacteric diseases of women, creosote and lachesis. Then yeah, leukorrhea, worse between periods, has a odor of green corn. So whatever smell of the leukorrhea, then the appearance of the stool, all these are very important. So leukorrhea symptom of creosotum is very peculiar. So acrid, corrosive, offensive, worse between periods, which is there in Bovista and Borax also, and has the odor of green corn, stiffens like starch, stains the linen yellow, and violent corrosive itching of pudendal, which that all may not come. So but just keep in mind. And yeah, the relationship part of creosotum, if you see, carboveg and creosote are inimical. So which is the inimical of carboveg or inimical of creosotum, they can ask. And it is common, you may be knowing. And creosotum is followed well by Rs, phosphorus, sulfur in cancer and diseases of malignant tendency. So which remedy followed well by arsenic, phosphorus, sulfur in cancer and disease of malignant tendency? That is creosotum. And the next remedy is from L alphabet, and lac canine, very important as far as competitive exam is concerned. Many interesting symptoms, sensations are there in lac caninum, and it is from the dog's milk. And yeah, the pain symptom we already told in Cali by from one part to another, all those. And yeah, make purchases and walks away without them. So Agnes, Anacardium, Causticum, Natramure, and lac caninum, very forgetful, absent-minded, and this purchases and walks away, all these remedies. And yeah, in writing uses too many words or not the right ones, omits final letter or letters in a word, cannot concentrate the mind to read or study, very nervous. So many remedies are there. So they can ask some four of them, I mean three of this list, and one another one which is not there in the except a question you can ask. So in writing, regarding the writing, the study problem, the study learning disorders, Bovista, graphitis, lachesis, and natrum carb, and lacaninum sepia. So yeah, despondent, hopeless, thinks her disease incurable, has not a friend living, nothing worth living for, could weep at any moment. So aurum, calcarea, semicifuga, that is actia, and lachesis and lacaninum. And chronic blue condition, everything seems so dark that it can grow no darker, lycopulse and lacaninum. So there is a chance of asking another one question, and except will be there. So lacaninum, lyco, and pulsatilla, chronic blue condition, everything seems so dark that it can grow no darker. And yeah, this is very important. Sinking at epigastrium, faintness in stomach, lacaninum. Sinking at the epigastrium, faintness in stomach. And the next, yeah, discharge of flatus from vagina, bromium, lycopodium, then ex moscata and sanguinaria, and lacaninum. And loss of milk while nursing without any non-cause, asafoetida and lacaninum. So sensations, I told you many sensations are there in lacaninum. Sensation as if breath would leave her when lying down, must get up and walk. Ammonium carb, grandilia, lachesis. So this way, if we see the Allen's keynote, a lot of interesting symptoms are there. So if we see here, the lacaninum relationship part generally acts best in single dose. So according to H.C. Allen, it generally acts best in single dose. Then lacaninum is a remedy, and probably no remedy in the Materia Medica presents a more valuable pathogenesis in symptoms of the throat, or one that will better repay a careful study. So that is about lacaninum. And the lac defloratum, one important sensation is as if cold air was blowing on her, then even while covered up, as if sheets were damp. So that is a interesting sensation, as if cold air was blowing on her, even while covered up, as if sheets were damp. An American sick headache, lac defloratum, American sick headache. And yeah, painful extorting cries during constipation with the stool large, hard, great straining, lacerating anus, painful extorting cries. So the lac defloratum, one question from 2015 is globus hystericus, sensation of a large ball rising from stomach to throat, causing sense of suffocation, asafoetida, calmia, and lac defloratum. Globus hystericus with large ball rising from stomach to throat. And this is an interesting case which is there in lac defloratum. A woman had taken 10 or 12 enemas daily, often passed 4 or 5 weeks without an evacuation, cured constipation of 15 years standing. That is about lac defloratum. So we know that lac defloratum is from skimmed milk, and there is an interesting note in the relationship part. The successful treatment of diabetes and Bright's disease with skimmed milk by donking was the hint which led Dr. Swan to patentize and prove it. Every symptom here given has been verified in the cure of the sick. So they may not ask this whole note, but they will ask who is the prover of lac defloratum, and that is Dr. Swan. Lacus is one of the very important remedy, and that is like for climatic ailments. We just gone through another remedy, and climatic ailments, hemorrhoids, hemorrhages, hot flushes, and hot perspiration, and burning vertice headache, especially especially at or after the menopause, sanguinaria, sulfur, and lacusis mutus. So lacus is drunkards with congestive headaches and hemorrhoids, prone to erysipelas or apoplexy. There are many interesting symptoms. We cannot skip anything of lacusis kind of remedies. And from any line they can ask, like sensation as of a ball rolling in the bladder, anything they can ask. And you can see one 2004 Twitter post Materia Medica question. Diphtheria and tonsillitis beginning on the left and extending to the right side. Remedies are lacusis, lac caninum, sabadilla. So beginning on the left, that is for lacusis, lac caninum, sabadilla, and extending to right side. That is an important question. And yeah, aggravation by hot drinks after sleep. And liquids are more painful than solids when swallowing. That is belladonna, bryonia, ignatia, and lacusis. And prostration out of all proportion to the appearance of throat. That is lacusis. And you can see one fever symptom of lacusis, annually returning, fever annually returning, paroxysm every spring, carbo, veg, and sulfur after suppression by quinine the previous autumn. And yeah, conjunctiva yellow or orange color in fever. Then aggravation of lacusis, if you see after sleep, then sun ray aggravation. They can directly ask aggravation after sleep. Lacusis everyone will write. So they will be asking aggravation, sun's rays, lacusis. And in intermittent fever, when this one natrum follows lacusis well when type changes. So this is a very important previous question. So WPSC means West Bengal PSC 2013 and Manipur PSC 2017 August. These two exams, this question was there. In intermittent fever, natrum follows lacusis well when type changes. So another remedy from Ericaceae family is Ledampal. Marsh tea is one common name. Labrador tea, then wild rosemary are the other common names of Ledampal. And there are many interesting symptoms of Ledampal, but one you can see emaciation of affected parts, Ledampal and graphitis. Also, selenium comes in this, so you can add that from the other part of the keynote. Selenium, Ledampal, and graphitis, emaciation of affected parts. They can ask like ledum, then graphitis, ledum and graphitis, ledum and selenium, then all the above, like that they can ask. So we one who have studied properly ledum and graphitis will go for ledum and graphitis, thinking that selenium is a confusing placing there. But there can be sometimes in like brackets they won't be adding. We have to add by ourselves by reading the Allen's keynote from the other parts. Okay, so maybe like we may not be able to cover all the remedies, but I just took the middle part because this way we can actually quickly like I'll be uploading this before 6 o'clock. So like you can after whoever is watching, you can go through the remedies like this. Don't read everything, only the very important ones, and some intuition will be there because of your mock test experiences, previous question working out experiences. That from the intuition some lines will stuck on your eyes, that only you go through now, because you cannot cover the whole book. And this is one important last moment revision, because last time also we have done a video that also I'll be posting in the description of this video, so that also you can go through that. From that questions can come. Very important one symptoms I have taken from many remedies. So that was very useful in last two AIAPGTs. So this will like close with Ledampal. Before closing, rheumatism or gout begins in lower limbs and ascends. That is, descent is Calmia and ascends is Ledampal. We have already seen. Then yeah, especially if uh, brought to a low asthenic condition by abuse of colchicum. So abuses, all those relationships, everything is important. So abuse of curine we have seen in lachesis, and abuse of colchicum in Ledampal, and affects left shoulder and right hip, left shoulder and right hip. That is agaricus, antimtat, stramonium, and Ledampal. Then easy spraining of ankles and feet, we know already Ledampal, but there is carbo animalis and natrum carb also. So those who have not like gone through the brackets, they may be thinking only Ledampal, but Ledam, carbo animalis, natrum carb, and all the above is there, means answer will be all the above. And long remaining discoloration after injuries, black and blue places become green. So don't go for arnica like remedies, it is Ledampal. Long remaining discoloration after injuries, the keynote of Ledampal, black and blue places become green. So that's all for today. I won't be going to the other remedies because it's very like vast book, and it will take your time, the valuable time of today's. So all the best wishes for AIAPGT 2022 aspirants, and let us know your feedbacks regarding the channel, how it helped you after the exam, and if possible download the app and come to Telegram group and discuss the questions after today's exam. Best wishes once again.